Hello, and welcome to the UCCS HealthCircle Primary Care Clinic Clinical Rotation Student Orientation. The Primary Care Clinic is one of 3 clinics supported by the Helen and Arthur E. Johnson Beth L. College of Nursing and Health Sciences. The other 2 clinics are the Center for Active Living and the Peak Nutrition Clinic. The Primary Care Clinic serves the Colorado Springs community to not only include community members, but also employees and students of the university, while providing quality patient care and supporting our student mission. We are an entirely nurse-managed clinic with nurse practitioners who focus on a wide range of specialties, from the LGBTQ community to behavioral health and women's health. For more information about our providers and the clinics prior to your clinical rotation, please visit our website at www.uccs.edu/HealthCircle. The mission of the UCCS HealthCircle clinics is to partner with and empower patients in a nurse practitioner-directed environment where holistic clinical practice, education, and research intersect to help patients achieve their healthcare goals. With part of our mission being student-directed, we support a variety of students at all levels to include our DNP students, NP students, and BSN students. In order for you to gain the best experience possible here in the clinic, you'll want to come prepared to work directly with both patients and staff. To do this, you'll want to wear your approved uniform, bring a stethoscope and any other equipment you would usually use in the clinical setting, come with some questions, bring a copy of your evaluation form for us to fill out, and arrive on time and ready to go. We are located in the Lane Center building at 4863 North Nevada Avenue in Suite 250, Colorado Springs, Colorado 80918. We are on the east side of Nevada, just north of Garden of the Gods. Since the building is part of the university, you must be sure to park in the correct spaces to avoid a parking ticket, as we will not be able to void tickets for you. If you have a parking permit that is valid in the orange and yellow lots, you can park in the lot directly west of the building in the rows closest to Nevada. If you do not have a campus parking pass, please park in the spaces to the south of the building between the Lane Center and the Ent Big. These are the 500 series, or otherwise known as the free lots, and you will not be ticketed in these lots. However, starting in the fall of 2018, the university does require you to register your vehicle in the parking portal, whether or not you are paying for a parking pass. For more information about this, please visit www.uccs.edu/PTS. When you arrive, you will want to go to the 2nd floor of the building to check in for your clinical rotation. If you come in the main entrance of the building and go up either the stairs or the elevator, you'll go to the half circle of check-in desks, and we will be the very last check-in counter for the UCCS clinics. Although no 2 days in the clinic look exactly the same, you may or may not have the opportunity to do the following during your clinical rotation: administer IM medications and immunizations, draw blood, give nebulizer or steam treatments, run urine dips, rapid strep tests, and rapid flu tests, room patients and obtain chief complaints, go over medications, and collect vital signs with a manual blood pressure, and give the report to the provider, as well as case management. One of the things you'll likely be doing during your visit is obtaining chief complaints from patients. The way that you'll obtain a chief complaint is ask the patient what they're coming in for, what's the purpose of their visit. If they have multiple chief complaints, which many of our patients do, you'll want to ask the patient what the most important reason for their visit is, what they would like to be addressed during this specific visit. During this time, you'll want to take notes and ask any clarifying questions if what they tell you is unclear, so that way you can give an accurate report to your provider. When getting information from a patient on why they're here for their visit, there are two acronyms that can help assist you. The first is PQRST, which is a pain assessment method. Since pain is typically subjective, self-report is considered a good standard and a most accurate measure of that specific patient's pain. The P stands for proactive. Is the patient's pain better or worse? The Q stands for quality. What's the pain like? The R stands for region. Where is the pain? The S stands for severity. How bad is the pain? And the T stands for timing. When did this pain start? What times of the day or times of the year is this pain more prevalent? The second of the two acronyms is OLD carts. OLD carts give you the 8 dimensions of a medical problem. The first is onset. When did this medical problem start? The second is location. Where is the problem? The third is duration. How often? The fourth is character. What is the problem like? The fifth is aggravating factors. What makes this problem worse? The sixth is relieving factors. What makes this problem better? The seventh is treatments tried. What remedies has this patient tried and what has been the body's response to these remedies? And the eighth is severity. How bad is this issue? When giving a report to the provider, in this environment, it will be a nurse practitioner, you'll want to give the provider the chief complaint and any additional information that's pertinent to that chief complaint. You'll also, however, want to give them a list of issues with the most important being indicated, which is most likely the reason that they're there for the visit. Another thing that you'll want to tell the provider is if the patient had any abnormal vital signs. Also remember that the provider can look into the EMR or electronic medical record at any time to get history on the patient. As previously mentioned, you'll want to bring your clinical evaluation tool so that we can fill it out for you. Once we've filled it out for you, you can take it back to your clinical instructor and it will be included in your final clinical evaluation at the end of the semester. Another thing to remember is that you can include this clinical experience on your resume. Thank you so much for taking the time to watch our clinical rotation student orientation video. We look forward to seeing you in the clinic. If you have any questions in the meantime, please feel free to reach out to us by the information on this slide. Have a great rest of your day.